Hi, my name is Jaden, and this is Living with CCI. CCI stands for Craniocervical Instability. It's probably what brought you to my videos. I believe this is my sixth one now. I just left off the last one telling everyone that I actually had a surgery, not a fusion surgery for CCI, but I had a more simple surgery to help address some of my nerve pain and chronic pain with occipital neuralgia. I'm not ready to release that yet because of some news I got a few days ago that my insurance company has, although they approved my procedure, they've changed their mind and now they're gonna audit the claim or whatever it is they do. So yeah, I want to wait until that business is settled before I tell everyone about it and sort of what was involved and what went into my decision making around getting that surgery. But I thought that this was an excellent opportunity to bring up another topic that I think is relevant to everyone, and specifically people in the United States, but is just dealing with health insurance. If you have CCI or any chronic health issue, you really have to understand the health insurance system and the way it works, and the benefits and the pitfalls of it. I grew up in Canada, which had a very different system. I imagine every country is a little bit different. So this video is going to be pretty specific to how things work in the US. And also, this is just what I've learned from my experience. So don't take any of this to the bank and hold me to it. I'm not familiar with every different type of insurance or everyone's situation and what their plans cover and whatnot. So I'm just here to share things that I've been through. I'll be able to talk a little bit about an appeal that I went through that was successful, but it was a fair bit of work, and it was actually kind of a little bit embarrassing, I think, for the insurance company. But I'll get into that later. It's kind of a fun story to talk about. But a little bit of background. So yeah, if you live in the United States, there are really, if you're under the age of 65 and you're working, like you have an income, then you're going to be on a commercial health insurance plan. If you're over 65, you're eligible for the Medicare, which is the government funded medical insurance for everyone of retirement age. And then if you are low income, there's another program, I believe, called Medicaid. In California, they call it Medi-Cal. And that's a government-funded health insurance for people with low incomes. But mostly what I'm going to talk about, which I think most people fall into the category of, you're covered under some kind of commercial health insurance that you're paying a premium for, and your employer or your spouse's employer is paying a premium for as well, as is the case for me. So with commercial health insurance in the US, there are two forms of it. One is called the HMO and the other one is called the PPO. HMO is Health Maintenance Organization and PPO is Preferred Provider Organization. So the difference basically is with an HMO, it's a bit like the Canadian system, actually. So I was kind of familiar with how that one works. You start with sort of a primary care physician that you have to pick one from their from their group, and then that person is in charge of your health care. And so if they determine that you need to see this specialist or that, or you need this, and sort of you basically just keep getting referred up the chain, but it's all within the same organization, medical organization. I think one of the biggest HMOs in the US is Kaiser. So a lot of people have Kaiser. And basically it's a full service, the medical services, covering every possible thing, but it's all within one sort of entity. And so the decisions, the patient, in a way it does simplify decisions for the patient because where you get your primary care is the same as where you're going to go for lab tests, and it's the same you're going to go for a surgery if you need one, and it's all within that one umbrella organization. The PPO, which is what I have, is sort of like a mix and match. So with PPO insurance, your insurance provider, in my case, is Aetna. So they will go out to all the different doctors in the country and say, hey doctor, like, would you like to see Aetna patients? And if so, like, would you agree to reduce your fee by this? In which case we can add you to our network. So it means that you have a much bigger diversity of medical professionals, as well as like facilities that say, yes, okay, we want to have Aetna's patient population, and we're willing to sort of take a hit on our rates. And so like anytime we see an Aetna patient or whatever your insurance company is, they will offer that particular rate to your insurance company. So that's why it's preferred provider. Now, a lot of PPO plans also offer what they call out-of-network benefits. So what that means is, like, if you're, let's say I want to see a doctor or specialist. Let's say there's a neurosurgeon that's like, he's the one I want to see. The ones that are in my network are not going to be able to help me, but I want to see this one, and he's not in the network. So I can go see him and pay, full price, basically, whatever he's charging. But I can claim that as an out-of-network expense. And so that goes against my out-of-network coverage. Typically, you're going to pay more if you go out-of-network, just because you have the accounting is tracked separately. So you have certain deductibles and co-insurance and stuff that's on the in-network side, and you've got a whole other set of deductibles and all that on the out-of-network side. So unless you're going to get a lot of care in the out-of-network side, you're generally going to want to try and keep all your appointments and lab tests and x-rays, everything in-network, so you're contributing and paying down the your deductible or whatever it is you have to do to get more coverage. So that's a little bit, at least my understanding of how insurance system works. I guess the next thing I would jump to is when you're looking at more expensive and more, controversial treatment, so to speak, like something like an injection of your, for example, I'll just give the story of what led to my appeal that I eventually won, but I think, made a bit of a fool of the insurance company. So I, early on in my treatment, I was able to see an in-network doctor in Washington, D.C. So again, the benefit of me having PPO is I could just fly off to D.C. and see this doctor who was a specialist in treating the neck. And he also was able to do injections high up in the spine, which are hard to find doctors that have the skill to do it. So basically he offered me some prolotherapy injections. And I knew, prolotherapy is a regenerative medicine, and like none of that is going to get covered by my insurance. It's just regenerative medicine is basically not accepted by, any insurance, really. So, but in any case, before he would do the prolotherapy, he wanted to do a diagnostic block, which is something that is covered by insurance. And so I said, okay, fine, like we'll do this. I just supported it too, because it's like, if you're going to do all this prolotherapy, I want to know that that it's going at the right level. So this was the concept that he presented. It's like, we'll do a diagnostic block. Your insurance, might pay for it. And then if it works and it gets rid of your pain, in the couple of hours that it takes the anesthetic to wear off, like you sort of realize like if this is the right place in the spine. And then once that's confirmed, then, then I could spend the money and do the prolotherapy. So I had this like diagnostic block. that was eligible for insurance coverage. And the office, the doctor's office, had submitted it for what they call a pre-certification. So that's just where they say, hey, like, we're going to do this to this guy, and here's his, his insurance number, and like, do we have authorization to do it? And generally, when it's anything that's either A, expensive, or B, like, unusual, they will almost always deny it. They'll be like, no, like, that it doesn't fit within our clinical criteria for medical necessity, or we consider it experimental or investigational or whatever. So what happens next is actually kind of important if you're encountering this type of situation. So if the doctor's office says to you, okay, your insurance has denied the pre-certification, therefore you have to pay us the $500 or whatever, which is I think what it was in my case. It was about $500. You need to pay us the $500. We'll do the procedure, and then you can fight it out with your insurance company. So in my case, like, I had flown there, and they actually, I didn't know until I think a day or two before I was getting this procedure that it was actually not, it was denied in the pre-certification. So I was like, well, yeah, I'll just pay, because I've flown all the way out here and I want to get all this treatment. And so, not knowing any better, I just just, for convenience, I was like, hey, fine, I'll pay the money, and then I'll fight it out later with the insurance company. So if a doctor's office is asking you to pay, what that kind of signals is that the patient, i.e. me or you, are going to be the one that has to stick handle the appeal and, process that goes on in order to get your insurance to cover the service. If, on the other hand, they obtain a certification, or even if they don't bother, it's actually not technically required that they get a pre-certification. It's just sort of it's I guess it's recommended, because then they know for sure, like, if it'll be covered or not. But yeah, if they agree to, if they're in network and they agree to do it on you, and don't take any money, then it kind of ends up being on them to handle all the appeal and the going through all that stuff. So yeah, if you're ever in a situation, but this is assuming that they're in network. If they're not in network, your insurance ain't going to help you. They're going to be like, no, you got to pay this, right? But yeah, if you go to someone in network and they treat you and they don't take any money, the provider will be the one, generally speaking, to go after the insurance company and because they want to get their money, right? So anyways, but in my case, and as this story goes, I had gone out to Washington with the hopes of getting this series of prolotherapy injections that were regenerative med, but as a precursor to that, I had this diagnostic block, which I was told was something that would normally be covered. But it was denied in the pre-certification, and therefore they said, well, like, we're not going to do this to you unless you pay us. So I just paid them and, kept the receipt, kind of thing. And I got home, and then, yeah, sure enough, like a week later, I got a letter in the mail. And it wasn't even from my insurance company. It was from some third-party company that contracts with Aetna, my insurance company. And basically what this company does is they just review, whatever it is the doctor's office submitted as far as, like, this is what we're doing to you. Or this is the procedure. And they review that against the insurance company's criteria, and they make a decision. And they must just get thousands of these, and I don't know, maybe they even use some like AI or something, but yeah, I honestly don't think that it's given that strong of a look. I think they just sort of try to deny things that they have any concern about at all. So yeah, you get this like very form letter from some third-party company that's decided like, no, we can't pre-certify this because A, B, C, D, whatever. So, but the key in this is that when you get that letter, it will tell you the basis for denying it. So that's important because this is how you're going to appeal. So you look in there, and what it will refer to is that they'll have something called a clinical policy bulletin. I mean, that's what Aetna calls it. I think all the companies have a similar kind of document. So clinical policy bulletins are I guess the very verbose, detailed explanations of what is covered and under what circumstances. So I think these are good, like, because you think about, okay, we all have to pay big insurance bills, and we want to keep those, premiums as low as possible. And so the clinical policy bulletins are developed, I think, with, collaboratively with doctors and the insurance company, and they kind of work out sort of a consensus on, what constitutes something that's medically necessary and what constitutes an effective treatment. Because we don't, I get it. They don't want people just wasting money or doctors taking advantage of, treating something that doesn't need to be treated, or it's not effective to do it that way. And so these bulletins are there. They're kind of the rules of the road, okay, for the doctors, as this is what we'll let you do, and, we'll cover. And if you go beyond that, then, you're on your own. And they're also there to protect the insurance company from excessive claims. So I get it. I mean, they have to be there. So anyway, so when you get this denial letter, you'll get the bulletin number and the name, and all you need to do is go on the internet, and you'll pull down that particular claim or bulletin. And you'll have to look through it. It might take you some time. If it's a long one, you might have to do some keyword searches, while it's still on the screen, to kind of figure out where you fit, where your procedure or case, fits into this bulletin. But this is what they've used to deny you. So the secret sauce is going to be somewhere in this document. So so you look through that, and then you find what it is that your doctor was trying to get approved and what the basis to get that covered would be. So in my case, I was getting a C1-2 diagnostic nerve block, and what was happening, and what I was able to determine by comparing, the letter to the policy bulletin and all of that, is that it was being denied because they thought, wrongly, but they thought that I was getting this as a therapeutic treatment. So he was putting, some temporary anesthetic in my upper cervical facet joints. He was doing it for diagnostic reasons to find out, is this an area that we should treat? And there's beyond prolotherapy. They could have treated it with a radiofrequency ablation or, other things, but it was diagnostic. It wasn't therapeutic. Therapeutic would be to kind of make me feel better for a couple weeks or something. So the insurance company does not support it as a therapeutic treatment, but they do support it as a diagnostic treatment. And they do stipulate, and again, I got this from the policy bulletin, they stipulate that if it's used as a diagnostic treatment, like a facet joint diagnostic block, that it has to be to evaluate a patient for potential for radiofrequency ablation. So that would be a reason to do a diagnostic block, would be we want to find out if it would be worth doing radiofrequency ablation on this guy, which is something that would be approved. So that wasn't quite the case with mine. I was getting it to confirm that he was doing the prolotherapy in the right place. But having said that, I thought to myself, well, he also in the appointment, because we had a pretty lengthy chat, my intake or my initial appointment with him. He did say that, and one of the options would be to get a radiofrequency ablation of the C2 nerve. So I knew that although prolotherapy was sort of his recommended treatment approach, it was a possibility that at some point, he might consider me for a radiofrequency ablation, which is what the insurance company was saying, would be covered. So what I did is I went back to the doctor, I just called the office and I said, hey, like I'm trying to, work this out with my insurance company, and I'm just wondering if you can add to the procedure notes that, one of the reasons, or basically that you were doing this to help determine if I would be a candidate for radiofrequency ablation. And they said, sure, we can add that because, it's not being dishonest. It's just saying that like that was one of the options for me, and it was a reason to do this block. It wasn't the only reason because I was getting prolotherapy, but he was also in a position to do a radiofrequency ablation if I wanted it. So they added that to the procedure notes, and they sent me a copy. And so I had the procedure notes indicating that it was diagnostic, A, that it was diagnostic, and B, that it was going to be used to determine if I was a good candidate for a radiofrequency ablation. So this is matching exactly what they're asking for in this clinical policy bulletin. So I'm feeling like, okay, I've done a pretty good job at this. And like the silly thing about this, I mean, it was a $500 claim. So, I put more work into it than I normally might, but I wanted to kind of learn the process. So anyway, so I get the doctors, I get the documents back from the doctor's office. I submit it to the insurance company. And so I got what was called, Aetna, and I think probably others have 2 levels of appeal. So if your claim is denied by that third-party company, that kind of automates the approval and denial, you can submit an appeal, and it's basically, I mean, you can even do it over the phone, I think, but you basically just give a little bit of information like, can you please check what this third-party company did because I don't think it's right. So I submitted that, and I submitted the records from the doctor's office, and I was like, okay, great, like, I'm gonna get my $500 back or whatever. So I waited, and then like I think it was a month or something later, I got another letter from the insurance company, and they're like, yeah, we've reviewed the decision of this third-party company, and I don't even think they looked at anything I had sent in because they just said like, oh, no, we agree, and, it should be denied, and blah, blah, blah. So I was kind of thinking like, I don't like this. I mean, I know it's only $500, but I don't like being jerked around. I mean, I took the time to do the research and to make this something that they have to cover, and I pay my premiums. My employer pays their premiums. And so I decided to take it to the second level of appeal because I had a reasonable chance at winning this thing. I mean, unless there was something that I didn't know, that I just figured that like, okay, I'm just going to take this all the way. So I called and I said, yeah, I want to request the second level appeal. So the second level of appeal, at least the way it works for Aetna, is that you actually get like a hearing. And it's done over the phone. It's sort of like a teleconference thing. But you actually get there's sort of like a coordinator that works for the insurance company that's more of like an administrative person. And then the other people on this hearing are doctors. So you actually have like you're getting to be able to make your case to real doctors. So I was kind of a little nervous about this, and just like, I was like, why am I doing this? It's like $500 or whatever. But anyway, so the day comes, I have all my notes ready, and I've sort of got a bullet point version of what I want to say, and I'd already submitted they already had all the documentation. To me, this was like a no-brainer, but unless there was something I wasn't thinking. So yeah, so the day comes, and I pick up the phone, and the insurance person sort of introduces herself, and there were 2 other doctors that were basically worked for the insurance company. So I'm like, okay, I don't know about that, but they were doctors, and they were there to be, to arbitrate the appeal. And then they said, oh, and we just have to wait because there's an external. And I'm like, what do you mean an external? And she said to me, oh, well, your state requires that we have like some other doctor that has nothing to do with the insurance company. So they have to pay some poor, some other doctor to come on this call to be sort of an independent party in this hearing. So I'm thinking like, okay, we got like 3 doctors here plus the insurance person. And this is a friggin' $500 claim. Like, I just thought like the ridiculousness of this was, I mean, it was just crazy. But so I went through it. I sort of, told them everything I had planned to say. And they asked me a couple questions. I mean, one of them was kind of like, why are you getting this treatment? And so I did have to give a little bit of the narrative, and I didn't get too deep into all of the CCI and all of that, because I just figured, oh, that's just going to cause, it's going to cause more contention. But I just said, no, I have these upper neck symptoms, and neurosurgeons can't seem to help me. And I found, somebody in pain management that can do ablations and other treatments. And so I got this diagnostic block. And they also asked me, like, they were just in various different ways, they were trying to make sure that this wasn't like a therapy, that I wasn't just getting the lidocaine put in the joints to feel better, that it was actually to properly diagnose the level of the spine so that I could get some other treatments. And anyway, so then like that ended, and they deliberated without me. I mean, I had to leave the call. And yeah, I mean, the next day the insurance person phoned me up, and she's like, well, you did a great job because like you won that appeal, and we're going to pay the claim and all this stuff. And so I'm just feeling pretty good about it. But I just thought it was just ludicrous for like to tie up all the time for those people, like over this, small claim, but whatever. I mean, it's the principle of it. And I learned something from it as far as like how to research that stuff out and, be more prepared for what if it's something bigger. So that was kind of the story of an insurance appeal. If you have another one to share, I mean, please put it in the comments. They're not, you don't have to be scared of them. I think they're there to sort of find the truth. And I think as long as you're honest and you have evidence and you have the doctor's office is willing to provide you with the documents, which they should be. I mean, it's your information, it's your health records. But yeah, if you can coordinate all of that, then you have the you're able to meet the criteria as are stated by the clinical policy bulletin, then it's worth doing. It really is. So in that case, what ended up happening is because I had paid the doctor the $500, right? And so the insurance company also paid the doctor. And so then I had to go back to the doctor's office and be like, yeah, I'd like my $500 back. And, that took like a whole other month to get that sorted out. But anyways, I mean, it was an experience. But I think easier is the case where if, an in-network provider treats you without taking the money up front, then they're usually the ones to handle the appeal and any issues like that. But yeah, if you're ever asked to pay, it's like if you want your money back, you're going to have to stand up for yourself and battle it out. So that's just that's kind of what I wanted to share. And I guess. In closing, I mean, with something like CCI, I think you have to accept that you're not going to be able to get a lot of your care covered. CCI is very hard to treat, and you need very specialized providers, whether they be physical therapists or neurosurgeons or pain management people that can treat like the upper neck and do injections really high in the spine. Like, it's going to be really hard to find providers in network. So that's just something to be aware of. And in my case, I get what's called a high deductible plan. So I actually choose to pay more as a deductible, but the benefit of that is I do get some tax benefits with a health savings account. So you might want to look into that. The benefit of the health savings account is that you can spend the money on any medical expense, and it's tax-free money. And in my case, like my employer does part of the contribution to that as well, because it saves them money. Me being on a high deductible plan saves the employer money. So, but yeah, with using my health savings account, if it doesn't matter if they're in network or not. I mean, even the regenerative medicine stuff counts. I mean, any medical expense can be, you can use the health savings account for any medical expense. So that's one little hack that I have available to me. Not everyone is going to be eligible for the high deductible, health savings account plan, but in my case, it's worked well for me. And we'll see if there's anything else I want to say about this, but yeah, it's tricky business. Like, just there's a lot of stress and anxiety, like especially when there's more and more money involved. Is like ultimately, like, who's going to be where does the buck stop, right? But I just encourage people, like, don't just take those default like automated denials. Like, don't just accept that, because I'm convinced that they're using some kind of they're not really looking at the stuff. They're just saying, oh, this is sort of out of the ordinary, so we're going to just deny it. They don't really look at it. So appeal, like, don't be afraid, people. Appeal when you feel like you have a case, and then if you lose that one, I mean, then you have to be prepared to really present something, because you're going to have real people looking at it, and you'll have to answer questions and stuff. But yeah, it's how it goes, and and so with that, I guess I'll wrap this one up a little bit shorter, but yeah, just it's important to understand like what's covered, because yeah, if you have a chronic issue, CCI or anything else, like, you're going to have these expenses like for years and years and years, so you're going to want to try and maximize whatever coverage you have, because that's what it's there for. Like, it's there to be used. So definitely try to read those bulletins closely. Like, if you're offered a certain treatment, particularly if you can get them to submit the pre-certification early, so you get that denial letter early, and then you can start to figure out, like, hey, what are they looking for in order to get this covered. But yeah, just like, it's a little scary, but it doesn't have to be. I mean, I think once you kind of dive into it, they do actually, in my opinion, like, those policy bulletins are very well organized and pretty clear. It's not like trying to understand the tax code or something. So, but yeah, you have to be willing to take the time and put the work into it. So. One last thing I'll say, just on the thought of taxes, you can also write off medical expenses on your income taxes. So don't forget that. Any unreimbursed medical expenses that are more than a certain percentage of your income are deductible. So keep track of everything you spend, whether it's regenerative medicine, whether it's like out-of-network stuff. Keep track of everything. Even transportation, and I believe, like, you can write off things where you're required to travel to see a doctor as well. So I don't give tax advice, but I'm just putting it out there that it's something to look into. Talk to your tax person if you have one. But yeah, that's another place. Like, especially if you're doing a lot of regenerative medicine, and you're getting PICLs, and they're like $10,000 each, and you'll want to be getting that as a tax break as well, because you're not going to get it covered by your health insurance with it being regenerative medicine treatment. So just in summary, understand your insurance and what it covers, and how to choose the providers as much as you can to stay within your the zone which you're covered, being the HMO or the in-network provider of a PPO plan. Don't be afraid to appeal any denials, especially if you're out money, because that's your money, and if you're in the right, you'll be able, in time, you'll be able to get it back. And yeah, and don't forget to keep track of all your expenses for your tax return as well. So yeah, hopefully this helps. This is a little bit more of a, I don't know, this one felt a little bit more technical or something, but I just felt like it is part of living with CCI. It really is, like understanding the costs and how to get things covered as much as possible. So hopefully that helps people. And I think, yeah, I'm going to do it. I'm going to start making videos about some of my lifestyle changes and the way I live and work. Some of the adaptations I made. I've got a special desk. I've got some equipment for some of the PT that I still do. I've got a neck brace that I use for being on airplanes. And so I want to get into all of that stuff in the videos to come. So please, please keep watching, because I think there's stuff in there that might help, or you can share with other people that you talk to that have CCI as well. So yeah, and yeah, please like the video. It will help other people to find it. Comment if you want to add anything, or if there's something I said that isn't true or doesn't apply, in certain cases for certain types of insurance. I'm really new at this, but I'm just sharing kind of my experiences, what I've known. But yeah, share yours, and we'll see you all next time.